If you already have a Medicare supplement plan, you might be wondering how you can change that plan. Maybe you've had a premium increase, or maybe you just want to change your coverage level. Today, I'm going to talk to you about the steps involved in changing that Medicare supplement, as well as what factors you need to consider because it's a little bit more complex than when you first enroll. So this is really important. Stay tuned. Hi, I'm Jamie Banner, and I'm the founder of Medicare by Jamie. I'm a licensed insurance agent that works specifically with people enrolling into Medicare, and today I'm going to talk to you about how to change your Medicare supplement plan. So this is for people who are already enrolled in a Medicare supplement plan or even a Medicare Advantage plan, and now you want a new Medicare supplement. Before we get started, if you find the information in this video helpful, I'd appreciate if you give a thumbs up and subscribe and leave a comment down below. And then we can dive right in. So if you've already got a Medicare supplement plan, you might be looking to change that plan. So maybe you've had a premium increase, maybe you want more coverage or less coverage, trying to save a little bit of money. There's a lot of different options you can do. You can go from one plan G to another plan G, a plan G to a plan N to a plan G, or from a plan N to another plan N. There's kind of a ton of different options that we can go around to change our supplement plans, but they all follow the same process. And it's a little bit different than when you first enroll into Medicare. So when you first enroll into Medicare, you've got a 6-month window from your Part B start date to get into a Medicare supplement plan with no questions asked. So your Part B starts, you have 6 months, and no plan can deny you. They have to accept you no matter what in that 6-month window. So that makes it pretty stress-free. You don't have to answer any medical questions. They're going to accept you no matter what. They have no choice. But once we get out of that 6-month window, health questions come into play. So if you're applying for a Medicare supplement plan 7+ months past your Part B start date, medical underwriting is the factor, and this is what we look at when we're changing our Medicare supplement plan is medical underwriting. In this way, the insurance carrier is able to ask us questions about our health history, and it kind of puts the power back in their hands because now they're at the option where they can approve us for a Medicare supplement plan or deny us. They really get to decide based on what factors they put a lot of weight into. But generally, most carriers have kind of the same criteria for their Medicare supplements if they're going to have to put you through medical underwriting. So the criteria are generally health questions, prescription history, and hospitalizations/medical procedures. So when we talk about health questions, it's going to be things like diagnoses and conditions. So there's kind of a long list of diagnoses that they're going to ask to see if you qualify. Usually it's things that are pretty chronic, things like COPD, Parkinson's, things like that. There's kind of a yes or no questionnaire. If you answer no to all the questions, that's great. That's a good step forward. If you answer yes, it gets a little bit dicey as to whether the application can continue or not. They're also going to want to know about medical events or episodes. So things that aren't necessarily chronic, but maybe a one-off like a heart attack or a stroke. Generally, these things have timelines. How long ago was it? Was it 10, 15 years ago, or was it 6 months ago? That's going to be a factor in those health questions. Also, current and future treatments. So if you've been to the doctor and he said, hey, you're going to need surgery in about 6 months, you can't say, well, I'm going to up my coverage then so I can pay less for it, because that's going to be a flag right there. You have to look at, do you have anything coming up, usually within the next year, because that's going to be a pre-existing condition, and that's a factor too. You can't just change your coverage because you've got a surgery coming up and you want a plan G now as opposed to a plan N. They're going to look at what's happened to you and kind of what the future holds that you're aware of. The next thing is going to be your prescription history. So usually they're going to look at your current prescription list, and they're going to want to know what you take that prescription for, and generally how long you've been taking it. The length of time is important to some carriers, some not. Some want you to take the medication for at least 2 years. But again, it's very specific as to what the medication is. And same thing too, if you've taken a medication recently for maybe you had a surgery or something like that, you have to list what medications you've been on and the reason for them. And some medications, it's really based on why you take them. If you take them for this, it's okay. If you take them for that, not as okay. The third thing is going to be hospitalizations and medical procedures. So they're just kind of looking at, were you hospitalized in the last, some carriers it's 5 years, some carriers it's 2 years. And they want to know what it's for. If you had gallbladder surgery, not a big deal. But if you've had some chronic repeated hospitalizations, that's something important they really want to know about when they're looking into your health history. Again, when we change Medicare supplement plans, the big factor is medical underwriting. Essentially, insurance carriers want you to be generally healthy to switch from one supplement plan to the other. And if you're just switching because maybe you have a premium increase, it's pretty much just going to be a big yes-no questionnaire when they look at your history. You'll likely have a phone interview, and they may even request additional information from your doctor to show your medical history. Again, this is something that is easy to do if you're generally healthy, and with the questionnaire, you just have to be 100% honest. So if you have any questions, this is what I do. I can help you find a new Medicare supplement plan. Give me a call. My number is 833-65-JAMIE. You can also visit my website, medicarebyjamie.com, or you can email me, jamie@medicarebyjamie.com. We can look in your area and see what's kind of maybe the best, most cost-effective supplement plan for you and work through this process of getting you into a new, lower-cost plan. If you like the information in this video, please give it a thumbs up and subscribe and leave a comment down below. Stay tuned. I'm going to give you a tour of my website and show you exactly how to request that supplement plan quote to compare in your area to see what's going to be the best deal for you. So again, thank you for watching. Hi, I'm Jamie Banner, the founder of Medicare by Jamie. I'm going to give you a quick run through of my website so you can easily navigate and find all the important links and information I provided for you. So when we get started, we're going to be right on the home page, and the first thing you can see is you can request a Medicare supplement plan quote. And that's what I do. I assist people in finding the best Medicare supplement plan options for them. So if you go ahead and put your zip code in there and a couple other basic pieces of information, I can get you the best supplement plan quote in your area. Once we get away from there and we go up to the top, we can see the Resource Center. So if we click on the Resource Center, we've got a couple options under there. The first one's going to be Video Library. So when we click there, it's going to take you to a page that shows you all of my YouTube videos. So all my videos will be on there along with their titles, so you can easily kind of search through them and see what video you're looking for based on your current needs. There's also a button up there that says subscribe to YouTube. So that will take you straight to my YouTube channel where you can subscribe, comment, do whatever you need, and find all the videos you need. When we go back to the Resource Center, the next link is going to say important links. And that's going to be a ton of different hyperlinks that give a lot of information like finding doctors that take Medicare, maybe filing a claim if you had something, lots of different things that can take you out to show you things you can do for Medicare. And the last section is going to be guides and forms. Now, this one is really important. I've listed a ton of forms that are going to be very important for Medicare. Stuff like employer coverage forms if you're still working past 65, IRMA appeal forms, maybe if you need to check your Part B premium based on your income. I have all of that here, plus a lot of different informative PDFs that's going to give you as much information as you need in Medicare, because that's what we want. We want you to be completely educated on everything Medicare related so you can make the best and most informed decision. I've also got it up here where everything is divided into categories. So if you need to find something a little bit faster, just click one of these categories and it's going to narrow it down to things involved in that section. Again, if you have any questions, you can always call me. My number is 833-65-JAMIE. You can also email me at jamie@medicarebyjamie.com, or you can go to the website and hit the Contact Us button and you can send me a little information. I hope you found this video helpful and thank you for watching.